U.S. health officials are pushing for all Americans to get a coronavirus vaccine. They say anyone who wants a shot should be able to get it. But many African Americans are wary. They're haunted by a medical experiment carried out against their community. NHK World's David McClure has the story.
To try and understand the distrust many African Americans feel toward the medical establishment in the United States, you can look to Tuskegee, Alabama. A museum at Tuskegee University displays records of experiments carried out on black men from the 1930s to the 1970s. The experiments were conducted by researchers with the U.S. Public Health Service. For 40 years, they studied the progression of syphilis in hundreds of black men, without their knowledge or offering any treatment. At the time, syphilis was a serious and deadly virus, and many of the subjects died over the course of the study.
They were never told they had syphilis. They were told they had bad blood. They developed a surveillance system to follow them in wherever they went to be sure they weren't treated. So they tracked them in wherever they went and to assure they did not get treated.
In 1972, a whistleblower brought the research to light. The revelation outraged people across the U.S. But it would be another 25 years before the government offered an apology, and the legacy of distrust remains.
Finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.
None of the men are living now, but their children, grandchildren, are carrying on the legacy.
Reverend Franklyn Richardson is a pastor at a church outside New York City. He wants to assure his community that the coronavirus vaccine is safe for everyone. He's already received his first dose, and he's vocal about others following along.
When I took the vaccine, there were white people in front of me and white people in back of me. So it is not being directed to one population over other. It's being directed to the total population. In my mind, the science is trustworthy. It is the stigma that must be broken down.
One company in Alabama is providing resources to minority communities to empower them to make informed health decisions. Their social media campaigns and videos often feature African American doctors.
So when we began to look at these kind of emergency use authorizations for vaccines, we have more confidence in that because actually that data was available. All those interim analyses were available.
The CEO of the company explains that providing information from trusted sources is essential to building trust with black and other minority communities.
We would have just information that we could give to people, and we could say, if we just give you more information, we know you're going to respond a certain way. But we know that's not the way it works, particularly within minority communities, that it's not just about more information, it's also about the message. It's about who's delivering that message.
Distrust of the medical establishment is rooted in the racism and medical mistreatment of the black community in the United States. But as the coronavirus continues to highlight health disparities in the U.S., members of that community are working to build trust and help those impacted most by the pandemic. David McClure, NHK World.